And now it is my pleasure to invite our plenary speaker for today, Professor Bruria Adini from the School of Public Health, who will tell us, well, this is the title of the presentation.
Thank you very much. Thank you for the opportunity to be here, and I'll try to speak to the mic. I have the tendency to walk around, so we'll try to make it work. What I'd like to speak about is the element of risk perceptions and actually go beyond only the pandemic, because when we want to consider the health perspective, we cannot actually isolate it from other things that pose some concerns for all of us. So we will look into the tides of risk perceptions in the Israeli populations during the COVID-19 pandemic, but also what has been happening since then. So this past year has been so challenging for, I think, everyone on the personal level, on the community level, on the society level, that I just want to take us back to the COVID and remind us all where we were and how it looked like over the period of 2 or 2.5 years. And you can see here the elements of the different waves, the 6 waves that started in the first case that we imported to Israel. You remember from the cruise ship, and through the times in March, the first infected patients were actually diagnosed here in Israel. And more or less, we had the different peaks during those 2.5 years. So when we look at the past 4.5 years, from 2020, when the COVID started, and up to what is happening right now, we actually had to cope with 3 major types of crisis or adversities. We had, of course, the COVID-19, as I said, 2.5 years, depending on what you actually count the amount of the patients or how much it concerned us. We then had the year of 2023 of the judicial reform, which is another type of socio-political type of crisis. And now all of us are, of course, a part of the current Iron Swords war, which started with the October 7th attack. And when we look at them, we hear hazards, risks, risk perceptions, and so on. And what I'd like us to, first of all, just understand the different concept and why do we have these different names and what do we mean by each one. So when we look into the hazard, what's the hazard? Hazard is a potential threat to the public health or the public safety. It can be a pandemic, it can be an earthquake, it can be social disruption, anything that actually poses a threat to our well-being, to our health, to our peace of mind, and so on. When we're talking about a risk, we're introducing 2 additional elements. One is the probability of its materialization, but also the consequences to each and every component of the population or to each and every one of us. So for example, we understand that when we're talking about the pandemic, all of us may be exposed to it. The probability may be higher or lower for some of us according to our level of exposure, but the consequences certainly can be different, right? According to our age, to our level of health, to other types of characteristics which may make us more vulnerable and so on. So the risk takes into account these elements which actually are supposedly objective about this probability and the consequences. But when we look into risk perception, we're talking about something else. Regardless of what the objective hazard is and the probability and the consequences, the potential consequences to us, risk perception is actually what people believe, how they look into the risk that we talk about. So that is actually based on what they believe. Do they think it can be severe or not? Do they think the virus may endanger them? Or they think, no, it's something that's of a conspiracy, it's something that The pharmaceuticals are actually pushing through in order to get some economic financial gain. It's the attitudes towards the authorities, towards those that tell us what we should or how we should behave, how they judge it, and overall feelings. Are they afraid of it? Do they laugh about it? Do they think it's nothing to be concerned about, and so on? And all of these elements are actually not objective, but they're based on different types of values, our social values, our cultural values, our religious status, and so on. Do we think everything is just controlled from some higher power, or do we have more control? Our experience. Was I infected? Was I not infected? I saw my friends being infected. Did it look like a big deal, or did it look just like another type of a flu, and so on? And the contextual elements, as well as the level of trust of the information we're getting, trust of the authorities that are providing these informations, and so on. All of these elements actually influence the way we perceive the risk. Is it something that will give it attention, or is it something that we think is not relevant to us personally, and thus will not give the concern or the attention that the authorities may want us to take? So if we look and try to understand what is the difference between the risk and the risk perception, the risk is actually based, or supposedly should be based on objective measures, on tools that can actually give us the objective picture and situation awareness of what is happening, what is the risk, what is the danger of it, rate of infection, and so on. It should be based on data that we collect and that we can analyze, and according to the analysis, decide what needs to be done. And actually, based on that, we are supposed to develop the policies, and the policies should be the ones that will direct the behavior of the different entities and the populations, so that we can try to overcome, to contain the pandemic or the different types of risk, and so on. So it's based on rationalization. But when we looked into the risk perception, we're actually going to a different type of platform. We're looking into the subjective elements. We want to see how psychologically we perceive this presumably type of risk, and so on. And it has a lot of emotions, and not only objective elements that are the basis for everything that is done. And it's also very much related to the communication strategy. Is the communication done in a way that actually touches us, that reaches us? Do we access the type of information that is being relayed, and so on? So all of these elements actually make it two different things: the risk themselves versus the risk perceptions. So the question is, why is it important? Why do we have to give so much attention? Should we give attention to the risk perception? So first of all, we need to, because we want to design communication strategy that are effective, because we can have very important messages to relay to the public, but if it's not done in a way that actually reaches or perceives as credible, as something that we want to take into account and act accordingly, then of course we will not be successful if we don't utilize the most effective communication strategy. We want it to impact on the behavior. So we don't just want to say it's important to maintain social distances. We're actually telling people the one that is sitting next to you may be of some danger to you during pandemics, right? You don't want to go and ask your neighbor for sugar and so on. You want to be isolated and so on. So if we want this to actually be adhered to and complied by the public, it means that we have to do it in a way that the public will actually want to listen to us and act accordingly. We also have to understand, what is the public actually concerned about? Are they concerned about the virus? Is this something that actually motivates them to behave in some way? And of course, the level of trust in those that tell us, the Ministry of Health, the government, physicians, other medical professionals, and so on. If we trust them, we'll probably listen more attentively and maybe do what they say. even then, we don't always do, right? They always tell us it's important to do sports, but how many of us actually adhere to that, even though we trust our physician when they tell us, you need to do sport and so on. And another element is the resilience. The resilience is our ability to actually cope and adapt to the challenges that are caused by those risks, and be able to actually recover from any type of changes in the way that we actually manage it, and either go back to our former previous pre-adversity level of functioning, or even bounce forward, be able to even be empowered by all of that. So I want us to try something that we actually do in our surveys. When we want to understand what risk perception is and what are the individual perceptions concerning the different risks, we approach the public and we ask them to rate from, for example, 1 to 5, or scale, 1 constituting not threatening at all, 5 constituting threatening to a very high extent, and we ask them for the different types of risk. Okay, so here, for example, we're asking for economic, health, political, and security threat. And this is actually what I'd like to do with all of you. We're all professionals here, so I want to understand your professional opinions. So you have the Mentimeter. You can either just scan it through the QR code, or go through your smartphone to Mentimeter. And when you get into Mentimeter, you'll see the code that is written up there. So please, each of you, I can see some are very quick and already doing it. So please enter the Mentimeter and rank according to what you think is the appropriate, according to your opinion, level of threat of each of these elements. Everyone scanned it? It's okay? Okay, so לא הספקתם? You can see the code. You can see on the top of the screen. No. You don't need an account. You just can go into either scan the code or go up according to the Mentimeter, menti.com. Okay. We're seeing some people still answering. Okay, what you can see on the screen are our collective perceptions, okay? We're in the war since October 7, right? But what you're seeing here on the screen is that according to the people that are sitting right here in this beautiful auditorium, that our perception is that the political threat and the security threat are almost the same, right? We can see the average. Right now, the security threat is a bit higher, but we also look at the political threat. We can see that the health threat is the lowest, okay? Well, let's see how that is actually, let's just go back to the presentation. This one? Okay. So, I'll show you in a minute how that actually is in line with what the public feels, and you'll see that it's not so different, okay? But I want to take us back to just a wider perspective at first. There was a study that we did more than a year and a half ago, 2 years actually, 2 years ago, in the midst of the pandemic. Dr. Moran Bodas, that is with us here today, was one of the researchers. We did this study as part of a European consortium. We were then still very much welcomed as part of the consortium. We hope that will continue also in these challenging times. And we did a survey in 8 countries, 8 different countries. What we used then were the actually categorization of the UNESCO, looking into different types of adversity. We look into pandemics, social disruption, critical infrastructure, extreme weather, and natural disasters. And you can see the similarities, but also the differences, the diversities between countries. So not surprisingly, since we're then in the midst of the pandemic, that the first and the adversity that was perceived as the highest risk was the pandemic. That was the blue circles that you can see. Let me try if I can have this work. You can see, no, okay. I'll depend on your seeing it by yourself. The blue circles were always the ones that were first. But what we also see, according to this type of measurement, is how far or how near each of the circles is to the country. So the yellow circles actually constitute the country, the person that is answering from each of the country. And we see that the distance, when the distance is closer to the yellow circle, it always means that it's perceived as more severe. When it's further away, as you can see in Israel, for example, we can see that although the pandemics was also perceived as out of the 5 different elements, that was the highest, it was pretty far from the yellow circle. So we could see that in relation to other countries like Spain or Romania and so on, or Sweden, we perceive the pandemic as something which is less severe. And you can also see the differences, what is happening with the other types of risk. For example, in Israel, the second one was social disruption, which includes conflicts and so on. You remember that even in 2021, we had a mini conflict, Shomer Chomot, Guardian of the Walls. So we perceived that that was the second severest risk. In relation to other countries, for example, Sweden, that thought that critical infrastructures, energy, water, electricity, and so on, that was the different risk. So we see that the perceptions are not equal at all times by all people in all societies and so on. So let's look at what we have found concerning the Israeli society. What I'm going to show you is the results of a quasi-longitudinal study. We started it in 2020. We measured it through the COVID and then through the judicial reform and later on now through the war. We're looking into the adult population of Israel, 18 and above, the ones that are Hebrew speaking. I'm saying Hebrew speaking because it does include Jews and non-Jews, but because it's in Hebrew, it's only a small, relatively small component of people that are not Jewish, which is a limitation. It's based on internet panels, on quantitative validated tools that we've been using in the study, and we've been measuring it over a long period of time. And you can see all the different elements that we measure. We measure the resilience, we measure positive coping mechanisms like hope, morale, or social solidarity and cohesiveness, as well as negative coping mechanisms such as distress, sense of dangers, as well as the perceived threats. So what did we find? Just to remind you of the times, the confirmed cases, community infection was in March. We started the vaccinations at the end of December 2020. The judicial reform started in the beginning of 2023. October 7th attack, something that we all know. And in April, there was the attack from Iran on Israel. So during the pandemics, we had 7 measurements. During the judicial reform, we had 2 measurements. And during the war up to now, we've had 4 measurements. The first measurement was in the week of October the 7th. We started 4 days after the attack. We measured again in November, again in January, and in April, again immediately after the Iranian attack, to see how it impacted on the populations. So let's start with what we were afraid of during COVID. As you could see, what we would think actually, we would have thought that the foremost would be the pandemic, right? We saw it when we looked into the formulation of the questions on the 8 countries that I showed you before. But here, what we asked was economic threat, health threat, security threat, and political threat. From the beginning of the pandemic in March 20 and throughout all the months, the highest risk was the political risk. The second highest was the economic risk. And look, the blue one is the health risk. So you can see that all throughout, continuously, that was only the third highest level of risk. So of course, you can immediately start to think and analyze how should that impact on the risk communication elements, how we're actually approaching the public, and so on. Let's see what happens during the judicial reform. Here, it looks more natural and more logical that the political risk was the highest one. Here we see some diversity between the place of the economic versus the security risk. And when we look into the war, then of course, again, naturally, the security one is the highest, but very close to it is the political risk, which is what we actually saw in the room. So again, what we see is that we need to check this over time because it's not constant and it's not always what we would think as something logical. Now let's look at the association between this and risk communication. So we understand that the risk communication has to be actually adapted or tailored to the risk perceptions. Otherwise, it will not be effective. It will not be impactful. And the severity of how we perceived the different types of risk is very relevant to what the public will give attention to. And the trust is something that is crucial to be taken into consideration. So I want to show you some of the elements of the risk communications. This is from September 20. We're still in the midst of the start of the pandemic, March till September. And look what Dr. Nachman Shai, who is an expert on risk communication, saying. He's saying, well, the public doesn't believe in lockdowns, and who can blame him? So we understand that the trust is important. Let's see what we can learn from the study. What we're seeing that from May to July, the trust is dropping, both concerning the Ministry of Health, which is the entity that we expect to give us the instructions, the police, which was in charge of trying to make sure that we actually adhere to the different types of protective measurements, and also concerning the media, that was a relatively lower drop, but all of these were significant differences between May and July. So we understand that there's a problem. If we don't give trust, then we're probably not going to act accordingly. I want to show you another element. For example, this was concerning the third vaccination. Let's look what the message they're trying to tell us. They try to tell us that it protects us, okay? Means that if we're concerned about the virus, then we'll go and actually get the vaccine. But when we look at the risk at that point of time, we can see that, again, the health risk was the lowest. We weren't concerned about whether we will or will not be affected or infected. We were concerned about the political risk or the security risk and so on, and then the economic risk, and only then the health. So if we want the risk communication to work, we actually have to at least try to answer to the concerns that the public is feeling at that point of time. Or in other elements, this was in August 21, we're talking about the police making higher efforts to make sure that people adhere or comply with the different types of protective behavior. We can see it here. We can also see it here. The policeman is actually saying that the public is fatigued and it doesn't feel the fear of the COVID and so on. But what is the police doing? It's increasing their measure to try to make sure that the public adheres. But again, what does the research shows us? The research shows us when we ask the public what would raise your level of compliance with these instructions, we see that the fear of the measures of the police, the fear of receiving a fine or supervision carrying by authorities and so on, that was actually reported by only a small fraction, 18%, 21%, as effective rather than, for example, believing that my staying at home will protect the health of my family. So again, if we look into the evidence base, we should put that into the policies and the risk communications for them to be effective. And now let's look at another type of elements, the association between the risk perception and behavior. And here we've been reading in the literature that there is a great association between the risk perceptions and what we will actually behave. So let's look if that actually works. Again, in our research that we did during that period of time, we asked people, the ones who were vaccinated, that was after following the first vaccination, infected, or neither vaccinated and infected, and we asked them, how do you now actually watch or adhere to the protective activities in comparison to the period before you were affected or before you vaccinated and so on. So we can see that the perception was that people that were actually ill, that were infected with the COVID-19 virus, they were the ones that had the highest change of behavior in protective measures. They believe that they're now protected and they disregarded the need, for example, for wearing masks, or we see the same thing, 30% said now they are less vigilant concerning social distancing and so on. They believe that the fact that they were ill protects them. So again, this needs to be taken into consideration when we try to impact them through risk communication. We saw the same with the vaccinations, okay? When we looked at the ones who believed at a moderate to a high level that the health risk is being impacted by the vaccinations, we saw at the beginning trend of people that had a higher level, a moderate and high level of belief, they went, that it may be harmful to them, they went to be vaccinated, but then we can see that that impact was not later on regarded as such, and we didn't see such an element. So we understand that this is it's a complex association. It's not only the association between risk perception and behavior. There are other things, and some of the things, for example, that we saw is the connectivity with resilience. The higher level of resilience, we saw the higher level of compliance with the vaccinations. You can also see here the different types of association which we found between the risk perceptions and other types of variables, such as danger, my well-being, anxiety and depressive symptoms and so on, community resilience and so on. All of these elements have to be taken into consideration. Of course, it makes our life as policymakers more complicated, but that's something that has to be accounted for if we want actually to impact in a positive way on the behavior. The last element that I want to share with you concerning the findings is what actually was found to be a predictor of the risk perceptions. So what can explain it? And I'll show it to you again in the three types of adversity. So when we looked into the COVID-19, you can see that throughout, and I'm showing you just part of the measurements, but it was pretty much the same throughout, the sense of danger, how much I feel that that might impact me, is the element that was found as the best predictor during COVID. Resilience and distress were at a different level, but were also found to impact. When we looked into the judicial reform, again, we see the danger as the highest one, and gender then became relevant. And when we look into the war, again, danger throughout continuously was found to be the element that was the highest predictor concerning the risk perception. I want to touch upon some limitations, and there certainly are limitations to the study. First of all, we have to take into consideration, we based our study on internet panels, and of course, people that don't have digital literacy are not included in these panels. This is a quasi-longitudinal study. It wasn't the same. It was always aimed to be a representative samples, but it was not the same sample throughout these 4 years. And we also have to take into account, which is a big limitation, for example, the Arab population, which consists of 21% of our population, was not represented in these high numbers just because of budget issues. If we had enough budget to also run it in Arabic, it would have given us important information. So I want to just conclude this element with several main elements. First of all, we have to understand the importance of the risk perception as part of managing different types of adversity. Risk communication has to be built on understanding of what the public is actually concerned about, and not things that we just assume as being relevant. We could see, for example, we would assume that the virus would be the highest risk during a pandemic, and it turned out that it wasn't perceived as such. The trust building is paramount, and we see this, it's not for nothing that we see this political instability as being mentioned and reported as so relevant throughout the different risks. All of these elements, the risk perception, the resilience, have to be assessed on an ongoing level. It's not static. It's not something that we can just take a snapshot and accordingly continue to do the same over time. And we need to take the different contextual characteristics in consideration when we take and build the policy making. The collaboration between the academia, between the researchers and the policymakers, this, I have to say, is something that I take even personally as a failure. Even though we provide all of these results to the policymakers and to the government and to the parliament, and it's open on the website and so on, we're not only concerned with scientific publications, we also want to use that as impacting decision-making. I have to say that I think we're not succeeding enough, or they are failing, because they don't always do it based on evidence-based. And I think if we manage to be more of impact, and they will manage to use more evidence-based in actually designing the policies, I think our society will be much of a benefit, and all sides will win. It really, truly will be a win-win, because the policies will actually be better complied with or adhere with, and we will be not just an ivory tower of research, we will also be able to impact the policies. So I want to say thank you for your attentiveness. As Itai started, let's hope our hostages will come back home very, very soon.
Thank you, Bruria. Before I open the floor to questions, don't go away. Now, just a comment. When I became the director of the center a few years ago, so one of our missions was to try to increase the awareness of the policymakers to steps that we thought will lead to better handling with the situation. And we were not indeed successful with that. It was not our fault, but no, so this reminds me of a story. So again, in the beginning, I thought, well, we are such an invest country. How come that in the decision, the departments, the of the government that are responsible for handling crisis situations, there are no drawers with already plans to cope with the situation. Later I learned that there are such plans and there are such drawers, but no one bothered to open them. So thank you, Bruria. Yariv, you had a question?
You're of course very, very right, and it is very relevant, and certainly everything that we read and that we are exposed to impacts on our perceptions of the risks. Our study looks into how the public perceives it. It perceives it based on what the authorities are doing, what social media is doing, what the media does or does not public and expose us, for example, and you said it's relevant for these days today, and you're right. We are not here in Israel seeing all the information that people surrounding us are seeing, okay? The risk perception shows the impact, okay? Now, what you're asking, do we look into the different types of factors that actually impact on it? So you're right, we do ask about the media. In some of the questionnaires, we ask about the social media and so on. In our study, we don't specifically investigate fake news versus deep fake versus true information and so on. There's a limit to what you can do and how much you can ask a person, and our questionnaire is already pretty long. So from time to time, we change some of the variables, but we haven't explored this type. There's another researcher that we work with that does look into these types of elements, which I agree are very, very important. How it affected the perceptions we see. That result we saw. Now, if it was done effectively or not effectively, I think all of us witnessed how it was done, but that's exactly the element that I touched upon on the risk communication, and that is part, life is complex, but the government or the Ministry of Health, the one that are in charge of the pandemic management, for example, have to take that into account. They can't say, well, life is complex. People are talking about conspiracy. People are talking that they're giving us vaccination because there's some going on between Pfizer and so on. Okay, that has to be taken into consideration by the authority. That's a reality they deal with, and that's why they have the authority to do so. Okay, but it all impacts on the risk perception. I completely agree. There is relevance to age and gender. We saw it in different elements, but when we looked into the predictors of the risk perceptions, you could see that age wasn't there, gender was there in one element, but not even close to the different types of perceptions, for example, sense of danger and so on. So it wasn't really proved, despite the fact that we know and we saw that there is age differences and so on, it wasn't proven to be a very high predictor. So that's not where the diversity is coming from.